Health Union Nehawu has expressed its disappointment that the rollout of the vaccine has been temporarily halted. eNCA reporter Masego Ratlache joins us now. Hi, Masego. So, of course, the unions, the health workers, the people who've been at the front line, who are hoping that the vaccines, which are meant to be administered from Wednesday, would give them some protection. They're obviously very, very disappointed. So, is it clear what needs to happen next?
Well, Sally, a lot of people, of course, were asking if this was a waste of money. People were very concerned about us procuring this vaccine and getting the first 1 million doses last week, and then suddenly finding out that it wouldn't be that strong in terms of protecting you from becoming either moderately or just, moderately ill. So people started being concerned about that, and they were thinking that it's not going to work. So does this mean we take the vaccine back to India? Does it mean we stop using it? And the answer to that from Professor Shabir Mahdi, who was the lead investigator into the Oxford AstraZeneca vaccine when they first brought it here to be put on trial. He's from Wits University, and he says the simple answer to that is no. We can still use it. He says it's not a waste of money. He also was saying that what needs to be understood is that there is no vaccine that will be 100% effective right now. The scientists are actually looking for anything between 50 and 80% to be able to at least stop you from getting too sick so that you don't need the hospital. As you know, in South Africa, we have a very ailing health system. We know that both the private and public health system were put under severe pressure, especially during the second wave and even the first wave in June last year. So that is what the vaccine is supposed to help us with, because it's supposed to make sure that you don't get too sick to a point where you need to go to the hospital, or the most important part is supposed to make sure that mortality is decreased. And what we know about this variant that is in our country and that is prevalent now is that most of our new cases, new infections rather, are 90% the new variant. And that's why a lot of people were very scared that, well, if 90% of our infections are this new variant, this is not going to work. But what it basically means, Sally, is that it's not going to go to all healthcare workers or frontline workers as originally planned, because now it's not going to be sort of a blanket approach. It has to be something that the scientists say you need to approach by looking at a person's age, the age group of people, and whether they have comorbidities. Wits last year did this trial on people who had less comorbidities and who were up until the age of 30. So it showed that it doesn't have enough efficacy there, but it doesn't mean that they can't repurpose it in trying to use it maybe in the older age group and people who have comorbidities. But here is Professor Mahdi explaining it better than me.
Certainly, I think there's still opportunity to use the AstraZeneca vaccine, but it can't be for your average healthcare worker that's not at high risk of developing severe disease. It needs to be a more nuanced approach that we repurpose the AstraZeneca vaccine for healthcare workers at high risk in the absence of any other vaccine being available. And the same thing goes for other individuals in the community. People that are at high risk of developing severe COVID-19, we're likely to experience a resurgence in a few months from now. And it is better to get a vaccine that is known to be safe at the least, even if so there might be some uncertainty in terms of just how well it's going to work against severe disease, than not to get anything. So if we say that we're not going to use the AstraZeneca vaccine, unfortunately what that means for South Africa is that we're not going to get substantial quantities of vaccine, at least until the resurgence arrives. And once the resurgence is upon us, it's too late to start acting in terms of getting people immunized. So I still believe that even the AstraZeneca vaccine, together with the Johnson & Johnson vaccine, at least allows us to immunize a target group that are at high risk of developing severe disease.
And I suppose we are somewhat lucky in a sense that our second wave is now receding and our third wave predicted around June. We've got a little bit of time. That Johnson & Johnson vaccine looks the most promising for us now, and hopefully they're going to get that rolled out soon. It's not yet rolled out. But in the meantime, of course, while the scientific community regroups and goes, right, what do we do now? You've been speaking to the healthcare workers who I would imagine many of them were really hopeful about getting the vaccine this week already. What are they saying?
Definitely, Sally. I mean, you'd remember we've spoken to many healthcare workers on this channel, some of them speaking about losing their colleagues to the virus, some of them talking about the trauma of having to treat somebody and watch them die because of the virus. So they were really looking forward to being inoculated from the 10th, which is on Wednesday. You know, they were hoping that this is now a start of something positive that is going to start happening for them to protect themselves, their families as well, in some way, because this gives you, of course, partial immunity, and we just need the herd immunity, that's 67%. But of course, they're disappointed now. The union actually told me something even more that they are concerned about, besides the fact that their members are disappointed in the fact that they have to still wait a few more weeks probably before they get inoculated. What they are concerned about are all these conspiracy theories that people have been believing, that have been spread across social media platforms and other platforms such as that. And they are concerned that the announcement from yesterday is just going to have those people even more negative, more afraid to be vaccinated probably, and that is what they are afraid of. And their solution is that government needs to have an educational drive to educate people more about this vaccine, especially because there are people who even think that the vaccine is a cure, when actually it isn't a cure. It's something that is just going to stop you from being too ill. So it doesn't mean that you won't get the virus, but you will, your soldiers, as they call them, your immune system, will be strong enough to fight against it once you're inoculated. So that's what the union is concerned about. Those people who are not properly educated around it and now finding out yesterday are probably saying, well, we knew it. But here is Zola Sapeta from Nehawu.
Of course, we have understood Johnson & Johnson. And we know the announcement by the government, but we can't be excited because we have learned in a hard way. As we're so excited about AstraZeneca, to be told on the 11th hour that these things have not been really at the level of efficiency, will not be making any significant impact. We hope that by the time the Johnson & Johnson will be arriving, such tests and psychological preparedness of our society would have been taken into account so that we don't get disappointed again. Having convinced them to really receive, the form of vaccines, because we need to be vaccinated. And so, but also, we need to educate our people about what the vaccine is about.
And Masech, of course, what we're seeing is not, the reality is that the scientific community is developing these vaccines and encountering problems and new variants, and it's all happening in real time. We are so used to being given a pill that's been researched for decades and has had all its trials, and then there's time to actually package it and give it to us. The reality is this is a developing story and a developing vaccine, and this is a roadblock that no one could have really anticipated a few months ago. So we are just going to have to go along with it as best we can, I guess.
Go along with it as and when it happens, Sally.
Absolutely. Thank you so much for your reporting, Masego Ratlachen.